New COVID-19 orders take effect at midnight, and here to explain what they could mean for your family is Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Good to see you.
Good to see you, Emily.
All right, so these new rules, according to these, people will have to wear a mask whenever they're in a public space. This is regardless of social distancing. Do you think this will still be a challenge for kids, or are you finding that your patients are getting used to them at this point?
Yeah, I do think kids have gotten a lot more used to wearing masks, and I think they've gotten a lot more used to seeing other people in masks around them as well. So I think those two things taken together, the normalization of masks, kids are seeing them on their friends, they're seeing them on their teachers, on their parents, and they're just getting more used to having them on their face is definitely helping. There's a bit of age dependence to that. Younger children are maybe more likely to have a hard time wearing a mask for a longer time, but even younger children have gotten a lot more used to them.
Do you think it's still important to offer mask breaks for kids?
I do think it's important, especially if a child indicates that they need a mask break. So older kids are certainly able to verbalize that for themselves. And if they don't need one, then, fine for them to not take one. But for younger children who may not be able to express what it is that's bothering them, we just may need to be a little bit more aware of cues, like them seeming a little bit more frustrated with it or fidgeting with the mask a lot would be a good time for them to take a break.
Something to keep in mind. All right, that fall sports season just about over. Soon kids will be moving indoors, back to hockey pretty soon, also basketball. What do players and their parents need to know about the risks?
Yeah, so those are all indoor gatherings with people outside of your household. So we know that those are conditions that lead to transmission events. And there have even been clusters that have been known to be associated with youth sports leagues, particularly when they're occurring indoors. So I think families need to keep that in mind. Other risks, though, or things that can increase the risk include the number of people who will be inside, whether there's going to be crowding, whether there's good ventilation, and whether everyone indoors is going to be required to wear a mask. So families can definitely look into all those things as well.
With so much attention on the pandemic this year, it's kind of easy to forget flu season. Last year's one of the worst on record. We had to go back and check this. Nearly 200 kids died in the U.S., a lot of these under 5 years old. Do you have the same concerns for this year?
Yeah, it was a bad flu season last year, particularly with influenza B strain, which is one of the flu strains that we see circulate every flu season. It's also one that's covered in the vaccine. So on the one hand, we do have concerns because there's also a lot unknown about if someone is infected with potentially COVID and influenza at the same time. But on the other hand, there's some hope that everything that we're doing to prevent COVID transmission, like masking and social distancing, will also reduce our flu numbers. So my best advice to people is to stay vigilant, and if you can get a flu shot, then get a flu shot.
All right, good advice. Dr. Moffitt, thank you so much for your time. We appreciate it.
Sure, thanks for having me.